Bismillahirrahmanirrahim. My name is Uzair Ali and currently I'm working as project coordinator at PASA HealthNet Echo Pakistan. We welcome you all on behalf of PASA Trust to this wonderful session by Dr. Muhammad Azeem. We are extremely thankful to PASA Trust for officially funding this session. So I would like to hand over the mic to Professor Iqbal Afridi and his team. Dr. Qamar Jabbar Saab, can you please take over the mic, please?
हेलो अस्सलाम वालेकुम सर, मेरा नाम डॉक्टर कमर है और मैं डॉक्टर इकबाल अफरीदी के साथ हूँ। सर इस वक्त अनफॉर्चुनेटली एक लेक्चर में है। मेरा ख्याल है सर का मैसेज आया कि वो शॉर्टली हमें ज्वाइन करेंगे। तो आफ्टर इंट्रोड्यूसिंग डॉक्टर अजीम, मैं सर का एक छोटा सा ब्रीफ इंट्रोडक्शन दे दूँ। Professor Muhammad Waqar Azeem is an inaugural chair of psychiatry for Sidra Medicine Hospital in Doha, Qatar. He is professor of psychiatry at Cornell Medical College, Cornell University, USA. Professor Azeem is a graduate of RMU and has done his general psychiatry training at Neptuna County Medical Center and Regional Hospital in Minnesota, USA, where he also served as chief resident. He has done his child and adolescent psychiatry training at Children's Hospital, Boston, with Howard Medical School. Professor Azeem is a diplomat of. Sorry? Yeah, I believe so.
कमर साहब, आपकी वॉइस थोड़ी सी डिस्टॉर्ट हो रही है।
वॉइस डिस्टॉर्ट है, एक मिनट।
आप लोगों ने दो लॉगिन्स तो नहीं लगाए हुए एक ही रूम में?
नहीं, वी हैव ओनली वन।
अच्छा,
क्या मुझे, कैन यू हियर मी? उज़ैर?
यस यस।
ओके, अब आप मुझे सुन सकते हैं ना क्लियरली?
हाँ जी, अब क्लियर है।
So I was introducing Professor Azeem. सर का थोड़ा सा बायो मैं जो ऑडियंस है उनके सामने रखना चाह रहा हूँ। Professor Azeem is a graduate of RMU and has done his general psychiatry training at Neptuna County Medical Center and Regional Hospital in Minnesota, where he also served as chief resident. He has done his child and adolescent psychiatry training at Children's Hospital, Boston, with Howard Medical School. Professor Azeem is diplomat of American Board of Psychiatry and Neurology in both general psychiatry and child and adolescent psychiatry. Sir, today sir का जो आज टॉपिक होगा हमारा वो है supporting emotional well-being of children and family during COVID-19. इस पे जो है सर अपनी थॉट्स हमसे शेयर करेंगे। तो अब जो हूँ मैं स्क्रीन जो हूँ डॉक्टर वकार अजीम के पास फॉरवर्ड कर रहा हूँ। सर, यू कैन प्लीज टेक ओवर द माइक and start your presentation.
Thank you so much for the introduction. Can you hear me okay?
Yes, sir, exactly.
So first of all, I am very thankful to Professor Iqbal Afridi and PPS for organizing this important event, and also like to congratulate all the frontline staff, what you're doing in these challenging circumstances to serve our children, women, families in Pakistan. So let me go to my slides. Okay, so you can see my slides, all of you?
Yes, sir, we are with you.
Okay, so this is such an important topic in current circumstances. COVID-19, I think, is a huge pandemic, and we have not seen anything like this in last 100 years. And this has created a big crisis leading to a lot of anxiety, uncertainty, fears in children and families, safety concerns, concerns over well-being of others, a lot of information we are getting. Sometimes it's right, sometimes it's not right. A lot of changes happening, a lot of moral distress. And our roles are changing as individuals, as family members, as loved ones, and our community is changing. But one thing is good, that we all are experiencing this. And it's important that we should feel that we are in this together. Before I go to the main topic, I think it's important to have some background, what is happening in Pakistan, because every country has different statistics, background, which impact the overall well-being of children, adolescents, and families. So population of Pakistan is about 220 million. And out of those 220 million, about 40% are children and adolescents, so about 100 million. That's a big number. Pakistan is one of the youngest population in the world. 1/3 of Pakistan's population lives below the national poverty line. And give you some perspective, about 1/3 of these people who live below.
Sir, sorry for interrupting you for a moment. There is request from one of our participants. Can you please display your slides in slideshow mode?
It's in a slideshow mode.
This is, I guess, presenter mode. Can you please go to the display settings at the top of your screen and select slideshow mode?
Actually, it's a slideshow mode.
All right, then please carry on. Thank you. Sorry.
Let me see if I can do something.
सर आप कंटिन्यू कीजिए, हम आपको देख सब कुछ सही है, यू कैन कंटिन्यू.
Still, I think it's the same.
Please continue, sir. We can see it.
Okay, so you can see it. Okay. I think the next slide is appearing on the right side. That's probably, it's a little bit smaller screen, right?
It's clearly visible. You can share it. Thank you.
Okay. Great to see you. Professor Iqbal Afridi just joined. I can see him on the screen.
अस्सलाम वालेकुम एंड आई एम सॉरी कि आज हमारा लेक्चर था उधर एसएमसी में, लेकिन इनको इंट्रोड्यूस कराया होगा डॉक्टर जो अजीम कमर साहब ने जो है ना बताया होगा कि डॉक्टर साहब कितने बड़े आदमी हैं और कितना इन्होंने वक्त निकाला हमारे लिए. अल्लाह ताला उनको खुश रखे. ही इज ऑलवेज contribute to Pakistan, to our country, in the form of developing syllabus for child and adolescent psychiatry at the platform of College of Physician and Surgeon. And he always contribute academic contribution in our national and international conferences. So therefore, without wasting further time, and people want to listen to you, so therefore I'll request you to start this program, and thank you very much.
Thank you. Thank you. Thank you for the introduction and invitation. So I was in the middle of sharing some demographics of Pakistan, because they do impact emotional and mental well-being of children and adolescents in the country. So about 1/3 of the Pakistan population is below the national poverty line. And that means about 1/3 of this population has daily earning of about 200 Pakistani rupees, which you can imagine how tough it must be. And more than 2/3 of this 1/3 population lives in rural areas. Huge numbers for children who are not in schools, which of course have a big negative impact. I was reviewing a recent budget, which was presented this year. So our total budget is 7,294.9 billion rupees. And you can see what is spent on education, which is 1.14% of the total budget. And what is spent on health, especially considering what kind of crisis we're going through. This is the country's health budget by percentage, which is of course very, very slim to meet the needs of all our children, families, and for the frontline staff. So, going on, what are the main challenges for child and adolescent psychiatry in Pakistan? A lot of countries have national strategy for child and adolescent mental health, and in Pakistan, there is no national strategy and no real dedicated funds for child and adolescent mental health. There are very limited clinical services. I can count on my fingers how many trained child and adolescent psychiatrists are in Pakistan. And mainly these services are in urban cities and not in rural areas. There is only one dedicated inpatient child and adolescent unit for the whole country, which has about 6 beds. So think about it, 100 million children and 6 inpatient beds which are dedicated for this service, which is I think, a crisis, national crisis. There is no formal training program for child and adolescent psychiatry. There's no FCPS yet implemented. There's lack of trained aligned health and nursing staff and very limited research. Before I go on to the main topic, I thought it was important to share some of the major facts about the country and how it is impacting our children, adolescents, and families.
सॉरी सर, मैं बीच में 1 मिनट के लिए आपको इंटरप्ट कर रहा हूँ। सर, आप पहले बिल्कुल ठीक जा रहे थे, अब आपका स्लाइड शो अनफॉर्चुनेटली रुक गया है। तो अगर हम आपकी स्लाइड्स नहीं देख पा रहे हैं, मतलब आपकी स्क्रीन सिर्फ स्टैटिक है। अगर जो भी आप स्लाइड प्रेजेंट कर रहे हैं उस स्लाइड पे क्लिक कर दें तो इट वुड बी बेटर।
Can you see it now?
नो सर, सर हमारे पास सिर्फ आपकी फर्स्ट स्लाइड आ रही है जो आपकी इंट्रोडक्टरी स्लाइड है। इसके बाद बाकी स्लाइड जो डेमोग्राफी हैं और जो बाकी आपके नेक्स्ट स्लाइड्स हैं वो नहीं आ रही।
Let me try again.
जी सर, प्लीज। जी सर,
I'm looking at.
जी सर, बेहतरीन है अभी आप।
अभी आ रही है कि नहीं आ रही स्लाइड?
It's excellent.
Actually, I didn't do anything. So it's just
Okay.
automatically the system. I didn't put anything again. It just started showing automatically on its own. How
Okay,
about
sir.
you see this slide, challenges for child and adolescent psychiatry?
प्लीज सर, बिल्कुल आ रही है।
रिकॉर्ड तो कर रहे हैं।
अभी ये वाली impact on children and families?
जी सर, बिल्कुल सही है सर। मैं ख्याल है आप कंटिन्यू कर सकते हैं।
I think it was a system issue. So with this pandemic, what we worry about, what as frontline staff, what you think about, some of the major things. First of all, our lives have changed. Lives of children, families have changed with isolation, social distancing, and quarantine. So when we think as a child and adolescent psychiatrist, I think it's very important to think in developmental perspective. Why developmental perspective is important? Because children who are very young, like 1 to 6 year old, they will behave differently as compared to children who are 6 to 12, who are in middle school, and then 12 to 18, who are teenagers. So it's important to have the developmental perspective in mind. What are some of the things which we see for younger children? What we see is that they are more clinging to their parents. They might have nightmares. They might regress. Some of them might have bedwetting. What kind of things we see in the middle schoolers, 6 to 12-year-old, that you might see more externalizing behaviors like temper tantrums, irritability, anger outbursts, some of those kind of things. And what we see in teenagers are a little bit different because they will feel more loneliness because teenagers rely a lot on their peers. And if they don't have peers around them, that impact them big time. And that can lead to more anxiety and depression. Then other impacts, losing loved ones or fear of losing loved ones. We have a lot of loss of families, members or loss of life in our country, and that leads to a lot of grief reactions. School closures leading to impact on the education and how children interact with the peers. And then excess of exposure to social media, whether they're getting a wrong information or getting too much information. Can you see the next slide? Just asking the moderator, can you see the next? So I'm going to ask after every slide, can you see the next slide or not?
No, sir.
Yes.
Yes, sir. Yes, sir.
I think there is something wrong in the system, that it's slow a little bit with my changing of slides. Can you see the slide now? Children with special needs?
जी सर नजर आ रही
Yes,
है.
sir, we can see impact on children and family.
And because it's a second slide on the same topic, which says children with special needs. You can see that?
Yes, sir.
So children who have special needs, like with autism and intellectual disability, it is a monumental crisis for the parents and for the children not to having routines, not to have the services which they typically used to get, speech, occupational therapy, or ABA, or those kind of services. Then we think about children and adolescents who have existing mental health conditions like anxiety and depression, and they're getting worse. So we should be aware that either it's new condition or existing conditions, when we should refer them to the health practitioners so appropriate services can be provided. Then there is impact on physical health, children not doing exercise, gaining weight. If somebody have diabetes or asthma, they're getting worse. And then most recently, or in last few months, a lot of financial impact, because a lot of people are losing jobs, and that is impacting the families big time. Then there are work-related stresses, because work models have changed, and a lot of people are working from home or in different circumstances, which is impacting the whole families. So what we should do with all of these? Can you see this slide? Studies.
जी सर बिल्कुल ठीक है.
Yes, sir.
So there are studies done actually looking at impact of COVID isolation on children and adolescents. And there are 3 studies done so far, one in China, one in Italy, and one is combined in Italy and Spain. And all studies were done in 2020. And actually, recently, our colleagues from King Edward are putting a paper on this particular, that what studies are done, and will be published in PJMS. So age range in these studies were 3 to 18 years. And what was found, main issues were irritability, fear of getting infection, clinging, attention problems, getting bored easily, restlessness, nervousness, feeling of loneliness, regressive symptoms. So all the things which I just mentioned about the developmental perspective of symptoms. Can you see this slide, how to talk to your children?
Yes, sir.
I will ask after every slide, because if it's not changing, I need to know, okay?
Okay, sir. Okay.
So how we talk with the children? Again, we should think about developmental perspectives depending on the age. So every child, depending on the age and family circumstances, might require a different interactions. First of all, we need to validate their feelings and concerns. So not overrun them that it's nothing is going to happen. तो हम ना खुल के ताकि बात कर सके, especially जो teenagers हैं. How we contain their anxiety, one thing which can play a big part is how we do the role modeling as parents and caregivers. Ask them what they already know. So sometimes we think children does not know anything, which is, I think, a misconception. Children usually know more than what parents think that they know. And then we should be easily accessible and spend some time responding to their questions. And then how we provide realistic reassurance, not like Nothing is going to happen realistically. There are challenges, there are crises, and then we can talk about what family has done successfully in the past to overcome these challenges and circumstances. Can you see this slide? Next slide.
Yes, sir.
Yes.
So one big thing is we have to be very careful regarding the social media, how much time children and adolescents are spending on the websites, because that is giving a lot of fearful and wrong information. And then how we should model hygiene practices and social distancing. There's very good guidelines by UNICEF and WHO for parents and families, very useful. You can Google it. I will not go into details. And then there are a lot of other organizations which have put guidelines regarding these things. And there are actually wonderful videos, very easy to follow for children. Can you see the next slide?
जी सर सर आपकी स्लाइड वैसे बिल्कुल ठीक बिल्कुल लूप पे आ गई हैं तो
You will let me know when you can't see the new slides, okay?
Okay, sir, I will address it.
So how we use the adoptive strategies like exercise, mediation, reading, family time is extremely important, more than what it used to be. So one thing is good, that might be some families have more time to spend with the children. So we need to have some regular time for board games or card games, whatever families prefer, playing video games together with the teenagers, doing art activities together. And there are a lot of websites which have some very creative ideas how to spend time with the families together. And also how to give some hope, because there are some things which you can plan for the future, which is hard to do it right now, but at least thinking about it, what might you do when things change? A lot of countries, like for example in Qatar, we are in the phase of reopening. So we are thinking about what to do with traveling or malls, or inshallah Pakistan will reach at the same stage probably. I'm hearing the peak will be end of July, beginning of August, so that will start later part of this year. Some of the other basic principles which you all know, which are very important for children and for adults, that I think if somebody sleep well and take physical rest appropriately, that take care of a lot of things. Having a balanced diet, how you utilize the free time doing things which you enjoy, can be gardening, poetry, music. Again, screens very careful. Regular exercise is extremely important. There are a lot of apps available that you don't even have to go outside the home to do some exercises. And avoid too much caffeine. Caffeine is the mother of anxiety, can worsen anxiety, and can cause sleep issues. I think it's extremely important for children to do well, that the parents are doing well, and the families are doing well, and the caregivers are doing well. So in this regard, I think what we do with the work, it's very important. A lot of people are working from homes or have different work requirements, that we pace ourselves. So for example, if you have a job sitting on the computer or in office, how you do after every couple of hours, leave your office, walk around a little bit, stretch yourself, do those kind of things. How you promote safety and well-being by like regularly washing your hands, social distancing, and minimizing the risk of exposure. How you use your PPEs regularly. It's a good time reaching out to your loved ones, whether inside your city, inside the country, or outside the country. I think it's a great time to connect with your family members and friends. And that might mean a lot to the people you reach out, but it usually helps your own mental health also. Rely on credible sources, and then how you use your calming strategies. I was looking at somebody, one of the CEOs of Fortune 500 companies. The first thing that CEO do is, in the beginning of the days, to be thankful for at least one thing in their life, which I think is a great way to look at this. how you use some of the breathing and muscle relaxation exercises, and then enjoy things. It's okay to enjoy. Don't feel guilty about it. Whether you enjoy book reading, walking, watching a movie, it's okay to do that. How you use some intellectually stimulating activities like puzzles, word games, chess. It has been found, believe in faith, spirituality, and prayers can help your mental health and well-being. So those kind of things can be very helpful. And don't deny all of these emotions. We all are feeling it. And for our families and for our frontline staff and for our leader, how you practice compassion and kindness, that will go a long way. Honor yourself for things what you're doing well. How you tell other people what they're doing well. Especially now I'm talking with our frontline staff and our leaders in the field, that it's so important that your junior colleagues in trainings, how you honor them, how you praise them, because it's not easy what everybody's doing right now. I think we work as a community, so child is part of a bigger family, and if something impact the child or the family, it impact everybody. Same way as the community. If community is impacted, whether it's your neighbors, whether it's your cities, or whether it's your country, it will impact everybody in the house, in the family. So what you can do to help the community, one of the most important thing is stop the spread of rumors. There are a lot of negative information, wrong information, how we should avoid spreading those rumors. How we support the community health drives. There are a lot of people who are losing wages, especially our daily workers, how we reach out to them. And then connecting with other faith communities, I think is extremely important. There was more when I was talking about the children and families and what we can do at that level. But then there are some things which are extremely important at a national level, which I think as frontline staff, you are the biggest advocate to advocate for those kind of things. How do we have national mental health strategies? A lot of country has national mental health strategy. Like in Qatar, we have a national mental health strategy since 2013. And there are 3 core principles of that national mental health strategy: that we provide right care at the right time by the right people. Extremely important, those 3 principles: right care at the right time by the right people. Our mental health law is very old. We need to have a revised national mental health law in Pakistan, at least to spend 5% of our GDP on health and education, which is, I think, very much needed. We are nowhere near. For health, we are spending less than 1% of the GDP in the country. We're spending about 21% on defense, which is important. I will not go into the politics, but I think there needs to be some balance. How we look at availability of effective clinical services in all the settings. Most of our services are in urban areas. And as you know, most of our population lives in rural areas. So we need to figure out how to build our community services. I was communicating last night with Professor Afridi via email, and it's an interesting story I will share. I think around 2013, I was involved in a first meeting with a number of my colleagues from Karachi, Rawalpindi, Lahore, about starting the Child and Adolescent Psychiatry FCPS. A lot of our colleagues in Pakistan worked very hard to build the curriculum and putting the MCQs and all the outlines together. To your surprise, I don't know if everybody who are online know that the Child and Adolescent Psychiatry FCPS was approved on December 15, 2014. The circular came from College of Physicians Surgeon Pakistan, and I received that from Professor Muwaddat Rana, who was the dean at that time. And it was one of the biggest day or one of the most happiest day of my professional career. That was 2014. At the same time, if you remember, if people remember some dates, December 16, Army public school tragedy happened in 2014. So it was back to back and very mixed emotions. And since Professor Muwaddad, we have Professor Farid Minhas as a dean for psychiatry, then Professor Sultan, and now, mashallah, Professor Iqbal Afridi is the dean. And Professor Ghulam Rasool has done a lot of work, and a lot of our other colleagues, Dr. Nazish, Dr. Aisha Sarwar, Dr. Aisha Minhas, Dr. Aisha Mia, Professor Imtiaz, Professor Sultan. Everybody has done a lot of work in building this program. And one of my biggest hope, wish, and dua is that we should have FCPS implemented during the tenure of Professor Iqbal Afridi. I think extremely important, especially looking at the needs. Again, going to the other things, allied health and nursing needs, how we train those people in child and adolescent psychiatry. And then if you think about public health model, there's no way we can meet the needs of our population just by psychiatrists or child and adolescent psychiatrists. So how we train our general practitioners is extremely important about some of the major aspects of child and adolescent psychiatry. If you think a lot of time or most of the time children spend in the schools, not in the clinics, not in the homes. So awake time. So from public health model point of view, services need to be provided inside the schools. Families should not be running to healthcare centers or medical centers to get these services. Parental training programs, I think parents in my mind are the experts of their children. We as child psychiatrists, I don't consider myself as an expert. I consider parents as the experts of their children, and we should have a very close collaboration with them and train them how to work effectively at homes, how we do certain media campaigns, which are positive media campaigns. And then I think one more very important topic for Pakistan is how we do some prevalence-based studies. With this, I thought share these two pictures with you, which is, it feels like a long time, but it is just February 20th and 21st that we had two in-person events just a few months back in Lahore. On the left side is the event about talking about future or career, psychiatry as a career among medical students. That was done in February 20th in Lahore, and was done under offices of World Psychiatric Association. You can see Professor Afsad Javed in the picture. And the second one is one full day symposium on child and adolescent psychiatry, again done on WPA platform, and President of Pakistan was there in Fountain House. So one reason for showing this was to have a hope and positive note that inshallah we will get there when we will have these in-person meetings and conferences. Thank you so much. And I'm hopeful. I know a lot of my very well-respected colleagues are on this seminar, and I also consider them as experts too. So it'd be good to hear their experiences, what their experiences in Pakistan in this particular area. And I will be happy to answer any questions also. Thank you so much.
Thank you very much, sir. Can you please stop share your slide as you did before? Yes, we are with you. I would like to hand over the mic to Professor Iqbal Afridi and his team. Over to you, sir.
Bismillahirrahmanirrahim. First of all, I am very grateful and thankful to Professor Waqar Azeem for sparing time, and his comprehensive talk on the child and adolescent mental health at the COVID-19, because in Pakistan we are really deficient in the component of child psychiatry. So his contribution in the form of this talk, as well as he does not spare any time to contribute academic contribution to our country. And this talk was very comprehensive and interesting and useful, especially for those who has done FCPS in psychiatry, and also for those who are the health professional. So I think this will improve our practice and do something for our kids, because most of our population is comprising of children. And let me also appreciate the great efforts of Mr. Uzair at the platform of ECHO. We are really thankful from on the behalf of Pakistan Psychiatric Society. I am very thankful to him as well as to the great speaker. And we want that because now we are in planning to have some policy for Pakistan. So Professor Waqar Azeem, may I request you to share the policy related to children health, mental health in your in the country where you are practicing. I have also requested our colleagues in Sri Lanka as well as the India, so that we can develop a comprehensive national policy. So that will be helpful, because that should not only address the current pandemic, but also the preventive aspect, as well as the curative and rehabilitative aspect, because we are expecting a huge number of patients in our tertiary care center. And just 1 hour ago, I was, I think Professor Asad Tamizuddin is here. We were in the same meeting, and we were discussing that we are expecting huge number of patients in tertiary care center, because the periphery system, the general practitioners are not able to detect and treat cases, and directly these patients will approach to us. My OPD, our OPD at JPMC is usually 450, and one day we received 690 cases.
Wow.
And so therefore we have to prepare ourselves, and for that we were discussing that we should have uniform policy for the helpline, as well as the telepsychiatry, as well as training the general practitioner, the nurses, so that we can tackle that huge number of psychiatric patients in the coming days. Thank you very much. And I'm also thankful to Professor Asad Tamizuddin, who always is very active to participate in these academic and the policy making activities and programs. Thank you very much. And I'm also thankful to the participant, because people really want to learn, especially our colleagues, our friends, Pakistani friends who are really at the peak of their career in other countries, but they always try to contribute to our country. Thank you very much.
Just a few words to Professor Iqbal, if you allow.
Yes, sir.
First of all, Assalamu alaikum, Professor Iqbal and Professor Waqar. It's always a pleasure to hear from you. And Professor Iqbal and I were in one of the WHO meetings, and we rushed over from that meeting to this meeting. And I think Professor Iqbal Afridi, as I always say, is very innovative, because he's the person who came up with this idea of creating this group of residents. Because of this group, these 250 residents are now getting aware not of what is happening in the country, but outside the country. So I think a very huge applause for Professor Iqbal Afridi for being so creative and innovative. He also mentioned about the policy, and we have a group of colleagues who are looking at the mental health policy, and we were quite surprised that the last revision was done in 2003. And I think that policy needs to be revised. I think the PPS is already onboarded. Professor Iqbal Afridi, Professor Mukhtar Ullah is here, and we have a group who are working on the policy. And I would be very happy that if you could share your policy. We already have the content from India, we already have the content from Bangladesh, and we already have the content from Afghanistan, though that's minimal, because we wanted to find out, and Iran, that what are the neighboring countries have done as regards mental health policy. So that goes for adults, for old age and children. So I think this is the time, because Professor Iqbal Afridi is the team lead who's also working on the policy for Pakistan, the mental health policy. So I think your input at this time would be very useful, and we could incorporate that section into the mental health policy. And once again, thank you for a very wonderful talk. I am sure the residents had a big advantage, and thanks to all the residents. Thank you all.
Let me request Dr. Nazish, because she is really instrumental for all the activities related to child and adolescent mental health, and we will also request her that she should contribute in the form of making this policy, and let's listen to her. She is very active and very cooperative in all the activities. When we request at the platform of call a physician surgeon for question bank, she always contributes. Now over to you, Dr. Nazish.
Thank you so much, sir. It's wonderful, and I congratulate you from the platform of PPS for arranging these very wonderful activities, which are very helpful, not only for the residents, but also for faculty members as well. And it's always a pleasure to listen to Dr. Waqar Azeem. I've been learning so much from him from early parts of my career till now. And even during this pandemic, he has been very helpful regarding few projects which we have been doing. He is always there to guide us. And I'll be more than happy to contribute. And Dr. Waqar, if you can also perhaps share with Dr. Iqbal Afridi and us the national autism policy, which Qatar introduced 2-3 years ago, because I think that's another aspect. It's only the Sindh Disability Act which have recently sort of notified autism and neurodevelopmental disorders. So if that could be part of the national policy which Dr. Iqbal Afridi and Dr. Asad Nizami is sort of doing, so that would be great. And we do hope that Child and Family Psychiatry or Adolescent Psychiatry Fellowship would be starting very soon under the guidance of Dr. Iqbal. I would like to have your comments, Dr. Waqar, on two aspects. One is, I was wondering, there are lots of sort of the problems which we are facing, at least in Lahore, is more related to special children and how the therapies have been discontinued, and as a result, it's difficult to engage young children in online sessions for speech therapy, psychological work. So how that is being addressed in Qatar, where you are working, so how the services for special children are being delivered. And another aspect, we do talk about limiting the screen time and balancing activities and decreasing the social media exposure. How would you see the online classes which are being conducted? So actually children are spending quite a lot more time on screens nowadays, because the majority of the schools are providing classes online. So how the parents perhaps needs to address these aspects and balancing the screen time with other physical activities as well. So if I can have your comments on these two, please.
So first of all, thank you so much, Professor Afridi, Professor Asad, and Dr. Nazish for your comments. I'm always grateful. It's always a pleasure. I still remember first time I visited different institutions was in 2006. And I still remember went to Faisalabad, King Edward, and AKU. So I still remember then it's about 15 years. One thing I have learned, to be honest, a lot of people abroad think that it's giving back. And I, over the last few years, has always thought it's not giving back. Actually, what I do for Pakistan, actually, it has given me back even more. So where I am, it is because of all the things what I have done with Pakistan. So I'm grateful. So it's an honor and privilege. I don't see that giving it back at all. Secondly, I will be happy to share the National Mental Health Strategy of Qatar. Only difference is population of Qatar is 2.8 million. That is the biggest difference, 2.8 million versus 220 million. That's the biggest difference. So things are different. So in my humble opinion, I think one is national, but then there is provincial strategies are very, very important, because every province by itself is a country, almost a country. So provincial and national both are very important for Pakistan based on the population. Then talking about Dr. Nazish mentioned about National Autism Plan. It's interesting how that came into existence. It was a concern raised by the families that children with autism are struggling, no services. So a lot of people came together and they created a National Autism Committee, which has everybody, including healthcare professionals, schools, parents, families, everybody, all the stakeholders. They met for 2.5 years on a regular basis, led to provision of that National Autism Plan, released in April 2017. And one very moving thing in that regard was I was involved in a meeting. It's a long, I think it's important to explain that, because that did make a big difference. So there are a lot of ministers in Qatar. So when you have a national policy, it's not just the health minister, especially if it's related with children and adolescents. It's education minister, it's transport, it's sports, it's a lot of other ministers. So there was meeting was called in by the Prime Minister of Qatar. And there were 9 ministers sitting over there with few of us from healthcare. And invitation was to 9 parents, and 9 parents who have children with autism were there in February of 2017. And every single parent took about 5 to 8 minutes to explain what it's like to be a parent of a child with autism. That was one of the most beautiful and most moving thing I've ever participated in, which had a huge impact. So people ask me, country like Qatar, only I think there are about 5 or 6 countries which have a national autism plan. It's like in US, it's mainly at the state level. In UK, it's at a different level. A lot of people ask me, how come Qatar able to have a national autism plan? When I reflect back, I think there were 3 things which were the most important for the country to have a plan at a national level. Number 1, commitment at the highest level in the country. So if you know, world celebrates World Autism Day. I don't know if you know, that came into existence because Her Highness Sheikha Moza bint Nasser from Qatar proposed that legislation to the United Nations in 2007, which led to World Autism Day. So the country's top leadership is behind having a national autism plan. That was number 1. Number 2, all the stakeholders were on the table and everybody was equal. So for example, I was the chair of the National Autism Plan, but I had the same vote and same input as any other parent or member of the committee. So all the stakeholders were equal and were sitting on the table from around the country for 2.5 years. And third thing is, the parents, they led this, not the health professionals. So if you have the people who we serve, part of what we want to achieve, you will have a better chance of being successful. So I think those 3 things played a very important part in it. Now going to the questions about Dr. Nazish asked about special children, children with autism, intellectual disability, and the school and on-screen online schooling. What we did in the country, and I will share a few other things what we did in the country. Country moved very rapidly to online system for children with special needs and for the regular schools. It's not ideal, it is not ideal at all, but it did give at least routine and schedule to the children with special needs and to the children who are in regular schools. It's so important to have a regular schedule. Very, very important. One of the biggest thing is how you to have a regular schedule, whether it's adult or children, if you're working from home or from institutions, that you take shower, get ready like you're going to work, not sitting in your bed, even if you're working from home. I know most of you now can't work from home, but that is something important to remember. So that made a big difference to have online schooling, and it was not ideal, but I think it was very successful. And there was a mandate nationally that needs to happen. So I talked with a lot of parents, which found it very helpful. Secondly, we as a service tried to provide virtual consultations very quickly. And we have actually better luck at show rate. So there was no cancellation. Everybody we were able to talk with on the video or on the phone, which sometimes don't show into the clinic. We have set appointments. So actually our show rate increased. So I saw something actually positive, that there are more chances of access if it's virtual consultations than when we try to do in person. Same probably will go for Pakistan too. Other thing is we try to decrease the duration between the appointments, especially for children who we think at much higher risk. And lastly, we created a national hotline for our frontline staff. And there was one site which was about mental health for our frontline staff and for our patients, who can call anonymously, and then we were able to put some services together. Country has a national response. It's a smaller country, which is very harder to do in Pakistan. But I know, for example, Sindh has done a lot. I see some of the things what Sindh province has done. Probably other provinces should follow some of the things what Sindh has done to help with that. I was looking at what the government and the army put together, one of the biggest high dependency unit in Karachi, which is about 140 beds. I was looking at a documentary of that. So a lot of positive things are happening in Pakistan too. I saw a message from our current Prime Minister Imran Khan on last time World Autism Day, that he wants to have a national autism strategy. So it's great to see our Prime Minister putting that kind of tweets or message. So there are some of my experiences, and I hope I answered some of the questions.
Thank you very much, sir. There is a question from Dr. Asad Nizami. Children have big anxiety about their future education plans. How to address that?
It's a very important question. Actually, I will give you even a personal example. And it is not easy. I hope I have the right answer for it. I give you a personal example. My son is going to start a university from Qatar. He just graduated from high school, who's going to start University of Toronto next year. And the huge challenge is when to travel. Is the university is going to be online, or is the university is going to be in person? And I know a lot of children in Qatar are struggling with, like, there is no SATs, exams are postponed, future goals are postponed. I think what help is, at least in Pakistan, now I'm making an assumption, over here in Qatar it's different because a lot of people for higher education goes abroad. So what we have learned is we go with the flow and you do the best you can. That is one advice. As a parent, not just as a healthcare professional. And you work with your teenager and you do the best you can. Second thing is, I think we have to be realistic. What is possible and what is available. And same goes at a national level and a provincial level. How I think government have to make some exceptions, how the exams are conducted, how the admissions will happen. I think it requires a public health approach, not necessarily a healthcare approach or a parental approach. It requires more of a national or a provincial approach, which I think will go a long way. At the same time, I think somebody asked me at one point, we know most of the children and adolescents are very resilient. Most of the human beings are very resilient. And what is resilience? So I see resilience, how you overcome adversity, that you can do well even in adversity, and on the long run when you go through adversity, when adversity is done. So what are some of the things which make children and adolescents resilient, or can make them resilient, or can make adults resilient? So there is some literature about how to be resilient. Number one thing, which is very hard to do in current circumstances in Pakistan. I know as a healthcare professionals, it's left and right how many colleagues we are losing, but still, how to have a positive outlook. If you look at the glass half full, or look at least some positive aspects at any time in your life, then always thinking about negative aspects that improve or increase resiliency. That is number one. Number two, if you have some compass, you have some grounding in some moral values, some family values, that can increase resiliency. Third thing, some literature says if you have some faith or rely on spirituality, that can increase resiliency. Some altruistic properties or characteristics of human beings, like for example, what you all do every day to help others, increase resiliency. Having a strong social support network or strong family network around you, improve resiliency. So instead of looking at one or the other, like what we can do about school, what we can do about anxiety, what we can do about depression, career, I think the most important thing I will look at is how you improve resiliency. I was looking at comments of CEO of Alibaba, and which is a big organization in the world. And I was thinking, I think two things nowadays, if you have it, it's great. One, if you are alive and healthy. Secondly, if you have a job, based on what is happening in the world. I think if you think in that way, we can be very thankful to Allah that what we have. Thank you. I hope that's answers some of the things directly and some indirectly.
Thank you, sir. There is one last question from Dr. Rosina. The primary factor in recovering from a traumatic event is the presence of supportive, caring adult in child's life, even when parent is not available. How children can be offered consistent, sensitive care that helps protect them from harmful effects.
I love this comment by Dr. Rosanna. She answered it, that you need at least one person in your life, which is a parent is the best, but it can be any person. So if you have that one person, it can go a long way. So she actually answered that question, which if there is no parent, then it can be a school teacher. It can be a psychologist. It can be you actually, healthcare professional, or you, Dr. Zina, yourself. If you see a child, when you provide therapy, it can, you need just one person. It can be a grandparent. It can be extended person. I think you are right on. Anybody in your life, at least one person who you can rely on, can help you a lot going through the traumatic experiences in your life. And again, resiliency can have a huge positive impact. Thank you.
Thank you. The mic is over to Dr. Kamar Saab.
Before inviting Dr. Mukhtar, who is the Secretary General of Pakistan Psychiatry Society, हमारी एक रिवायत हमने की है कि हम ऑनलाइन एक सर्टिफिकेट देते हैं, और उसके साथ साथ हमने ये भी तय किया है पाकिस्तान साइकियाट्री सोसाइटी के प्लेटफॉर्म से कि हमारे ये जो हीरे हैं जो बाहर काम करते हैं, वकार, अजीम जैसे, इनको हम ऑनररी मेंबरशिप पाकिस्तान साइकियाट्री सोसाइटी की दे रहे हैं। अभी इंशाल्लाह वो हम भेजेंगे, लेकिन आज का सर्टिफिकेट डिस्प्ले कर दें और फिर मुख्तार साहब कमेंट्स दे दें।
Thank you so much, Professor Afridi, or I should say Afridi bhai. It's always pleasure And Asad and Nazish, you are all wonderful colleagues with us.
उनकी तालियां होनी चाहिए। और हम पाकिस्तान साइकियाट्री सोसाइटी पे डिजिटल इनको भेज देंगे। मुझे मिल गया आज कि ये वो फॉर्म भर दें, तो हम उनको दे रहे हैं। तो मुख्तार साहब से रिक्वेस्ट है कि वो अपने ख्यालात का इजहार करें। और
Can I make a quick comment, Professor Fridi?
जी जी।
Thank you for this certificate. Don't send it me digitally. Inshallah, I will receive it when I visit you in Karachi.
Oh, that will be a great pleasure for all of us. ठीक है। तो वो मुख्तार साहब, can you hear me? और अगर मुख्तार साहब हैं, नहीं तो फिर वो वहाब साहब अगर हैं तो वो अपने ख्यालात का इजहार नहीं। डॉक्टर वहाब, अब्दुल वहाब, मैं मुख्तार हैं। अच्छा अच्छा ठीक है। तो असल में जो है ना, ये सुनना चाहिए वकार साहब, हमने ऐसा किया है कि एक एक जो लाइन में कई लोग बैठे हैं। जैसे हमारे हॉल में जो है कई लोग बैठे हैं लेकिन लाइन एक है, तो ताकि
I
हम
didn't
दूसरों
know that.
को
I thought it's 45 people, so it's like institutions.
institution, yes, so that you have to multiply with at least 10. So इसका और हमने ये इसके साथ साथ उज़ैर साहब का और उनकी टीम का, एको के लोगों का शुक्रगुजार हैं कि उन्होंने 1000 लोगों की कैपेसिटी रखी है। लेकिन हमने सोचा कि क्यों ना एक ही लाइन में जो है 20-20, 30-30 लाइन लोगों को अकोमोडेट करें। तो ये हमारी स्ट्रेटजी थी।
Wonderful. That is excellent strategy. We're thankful. I hope it was helpful for all the participants.
हमने बहुत बड़ी,
I think I learn more from you rather than you learning from me. So I was hoping more input from you, not just questions, what you do in Pakistan, because I learn every day.
थैंक यू वेरी मच। अच्छा, हमने एक एलईडी बड़ी ली है, पिछले हफ्ते ही लगा दी है उसको रिप्लेस करके कि सारे लोग देख सकें हॉल में। तो इसलिए हमारी जो गर्दन ऊपर ऊपर हो रही है वो इसीलिए हो रही है कि एलईडी पे है। थैंक यू वेरी मच।
Thank you.
ओके, अल्लाह हाफिज।
Okay.
Thank you and all the participants.
And thank you so much. And again, you all are amazing and what you do every day for our people in Pakistan. Thank you for your dedication and hard work.
Thank you very much.
On behalf of Parsa Trust, we are extremely thankful to Chaudhry Suhail Saab, who is owner of Parsa Trust and solely funding this project, and our director, Dr. Asad Ali Chaudhry Saab, Tabarak Hussain Saab, our co-director, Professor Altaf Alam Saab, our SIN focal person, Dr. Zishan Ali Junejo Saab. PAM is basically a project like a youth ambassador movement, and we are also conducting psychiatric sessions for children as well under flagship model of PAM. Dr. Anna is leading that. Our eco consultant, Dr. Bushra Saiba, our project administrator, Mrs. Kiran Afshin Amir, and our IT person, Haris and helper Salman. So till next time, Allah Hafiz. And thank you, all of you, for joining this session.
Thank you.